Despite an increase in a new and younger generation of nurses, shortages will continue over the next several years. That is according to a new Maine Nursing Action Coalition report today. News Center Maine's Vivian Lee takes a closer look at that report and what is being done to address the issue.
Every year over the past 3 years, around 900 registered nurses in Maine have entered the workforce. However, experts say 500 additional graduates are needed annually to meet a projected shortage of 2,817 nurses by 2030.
And that is rough to alleviate the shortage in 2030. And that would have to happen every year between now and 2028. That's a tall order.
Pat Cirillo of the Cypress Research Group prepared the forecast released by the Maine Nursing Action Coalition on Friday. The demand for care is rising as the number of baby boomers reach 65. That's expected to peak in about 3 years, but the report has bright spots. The number of nurses working at the bedside under 35 has risen by 29% over 7 years. 40% of nurses are also working past retirement age.
Nurses are working well into their 60s, more so than they did when we started this data analysis.
Do 3, here we go.
Nursing officials say inroads have also been made in educating the next generation of nurses. The Maine Hospital Association represents 34 hospitals statewide and is the largest employer of nurses. Hospitals expanded clinical training sites, a core component of nurse training.
We've done this with a particular focus in our rural hospitals where we have seen greater shortages of nurses.
To help with the shortfall of nursing educators and faculty, Maine Health provided expert clinical nurses to train nurses in medical settings.
We provide up to 30 clinical cohorts for the University of Maine system and for the Maine Community College system, just to be able to take their students.
Now, the report also found the number of nurses leaving the profession altogether and/or who are working per diem is on the rise. But nursing officials say efforts are well underway to bring those nurses back into the workplace full-time.
An education RN refresher program here at Maine Health so that they feel more prepared, better prepared to go back into work.
There's also hope state funding to offset nursing school loans and investments in hands-on training will help grow the population of nurses as the need for skilled care mounts. In Portland, Vivian Lee, News Center, Maine.